Alright, here's my final video for health and physical examination, and this is my head-to-toe assessment. So to start off a complete head-to-toe assessment, I would have the patient, they would be coming into the room, and upon arrival I would just get their general appearance and do some basic screening questions to see what the goal of this visit is. I would assess their level of consciousness. Can you please state your full name for me?
Claire Victoria Haight.
Alright. What day is it?
Monday.
What year is it right now?
2020.
And who is our president?
Donald Trump.
Okay, so she's alert and oriented to what is going on. I would assess her skin color, her nutritional status, her posture and position, and any physical deformities that I can see just upon a quick scan. I would assess for involuntary movements that I may see happening, her mood and effect, and then throughout the assessment I will be keeping an eye out on her speech and her hearing. After that, I would go forward and do the Snellen eye test with the eye chart, but I do not have that with me. After that, I will inspect her hands and her nails. While doing so, I'd look for any physical deformities. I can assess her temperature and her skin and look for any lesions. After that, I would move forward and take vitals. Alright, so for blood pressure, I got 110/57. Alright, and I'm going to just check your pulse. Alright, so I got 64 beats per minute and 8 respirations per minute. After that, I would get a temperature from her along with a height and a weight. After completing vitals, I will move forward and inspect the head and the face. I will start by just palpating the scalp and seeing if there's any abnormalities in the hair distribution. Right, and then I'll palpate the sinuses and assess for tenderness. Do you feel any pain?
Nope.
And then I will palpate the temporal artery. And then assess the TMJ. Can you open and close your mouth? Okay. Now I'll move forward with the eyes, and I'll start with the vision field test. Can you cover one of your eyes with this? And tell me when you see the pen.
No.
Switch eyes.
No.
Perfect. After doing that, I will inspect her pupils and the external structures of the eyes, looking at the eyelashes, the eyebrows, and the conjunctiva, the sclera, and everything. Alright, her pupils were brisk and reactive to the light, and they were also equal. And nothing stood out just looking at the eyes. I would then use an otoscope and assess for red light reflex, and then look at the optic disc and the macula. Now I'll test for accommodation. Keep looking directly at the pen. Perfect. And then, I will check for ocular motor muscles. Don't move your head, but follow the pen. Perfect. Now I'll look at the ears, and I will just visualize the external structure of the ears and assess for any tenderness when pressing on the ears. Any tenderness?
No.
What about this side?
No.
Perfect. Her ears were equal in position, they were symmetrical, and there was no tenderness. After that, I would use an otoscope to visualize our auditory canal and the tympanic membrane. Now I'll move forward and do the whisper test. Repeat what I say.
Monday. Pizza.
Okay, so she passed the whisper test, and then after that I would use a Weber test with a tuning fork on top of her head, and then I would do it as well on her mandibular joint and right outside her ears to test for that. After that I will look at her nose. I will look at just the external factors of the nose, make sure it's symmetrical, and there's nothing outstanding there. Can you breathe in? Again? Perfect. And then with the nasal speculum, I would inspect the interior portion of her nose and just make sure everything is good there. Now I will look at your mouth and your throat. Can you open your mouth? Can you say ah? Alright, I would inspect her gums, her tongue, her tonsils, and the floor and roof of her mouth. Also looking at the mucosa. And then when she said ah, I was checking the uvular movement. Now I'll move forward with inspecting her neck. First I would just inspect for jugular vein distension or anything that stands out. And then I will palpate her neck. I would feel along her spine for any deformities and palpate her lymph nodes. After that I will palpate her carotid pulse on both sides of her neck. And if possible, I'd palpate her jugular pulse or just look for jugular vein distension. And then I would test her range of motion by having you move your head forward and backward and side to side and turn. Alright, and then do it with some resistance. Perfect. And then I would move forward and inspect her back. In a healthcare setting, I'd have someone open up the back of their gown to view it, and I would just look for any skin deformities and check for symmetry. After